very exciting results at this year's ASCO meeting in brain tumors. First of all, a study conducted by James Perry from Canada and colleagues in Europe and Japan demonstrated that for older patients with glioblastoma, the addition of temozolomide chemotherapy to radiotherapy clearly prolonged survival relative to radiotherapy alone. That had been clear in younger patients, but had never previously been demonstrated in older patients. The second major practice-changing trial was conducted in Europe and the United States, led by Martin Vandenbent. This was a trial for patients who had what are called anaplastic gliomas. These are slightly less aggressive variants of glioblastoma. And in particular, this trial was conducted for patients whose anaplastic gliomas did not have a biomarker which is thought to be sensitizing to chemotherapy. So these patients had anaplastic gliomas that were thought to be relatively insensitive to chemotherapy. Despite that molecular profile, these patients clearly had a prolongation of survival from the use of adjuvant temozolomide after radiotherapy. There was another trial presented today by Wolfgang Wick on behalf of the EORTC for patients with recurrent glioblastoma who were randomized to receive either lomustine or lomustine and bevacizumab. And like the trials of bevacizumab in newly diagnosed glioblastoma, bevacizumab in the recurrent setting prolonged progression-free survival, but not overall survival. And whether that is important as a result remains controversial.